Hi, we are Nikki and Carylle, nursing students from the University of Manitoba, where we are currently having our final clinical rotation here at Ronald McDonald House Charities, Manitoba.
RMHC Manitoba provides essential services and a home away from home for rural families with a pediatric child receiving medical treatment in a hospital. RMHC Manitoba values inclusivity and honors the diversity of the families they serve. They also act with empathy and compassion to help support the health and well-being of the children.
Having a loved one in the hospital and being surrounded by the hospital environment can be very stressful and overwhelming for many people. Here is a fictional scenario that encompasses the various stressors that families may be experiencing.
Meet this family from Steinbach. They have been staying at RMHC Manitoba for several weeks now as they have their 4-year-old daughter in the hospital. Their daughter is hospitalized for a complex medical condition, and her treatment requires ongoing hospital stays, surgeries, and specialized care.
They have faced numerous medical appointments, sleepless nights, and the constant worry for their daughter's well-being. The daily stress, coupled with being away from home, taking time off work, and caring for their other children has started taking a toll on the parents' mental and physical health.
Both parents have been experiencing increased fatigue due to long hours spent at the hospital and from lack of sleep. One parent has been experiencing migraines and mood swings, whereas the other seems more apathetic and low on energy. The stress has led to more tension and disagreements between the parents. Additionally, they find it challenging to engage in self-care due to a lack of time and feelings of guilt.
Stress is a state of mental or emotional tension caused by demanding or difficult situations. Everybody experiences stress in some way. While some stress is normal, too much stress for a long time can be harmful to your health and well-being.
Caregiver burnout, also known as caregiver strain or stress, is the physical, emotional, and/or mental exhaustion experienced by caregivers when providing continuous care and support to a loved one who is sick, elderly, or has a disability.
Caregivers may face challenges when juggling their caregiving responsibilities with other life demands, such as work, family, and personal needs. Some examples of possible stressors include being far away from home, financial difficulties, lack of social support, negative interactions with the child's medical team, the birth of a child, and parenting other children. Some stressors related to their loved one's health condition may be the uncertainty of prognosis, multiple procedures the child may go through, complications, or having to make decisions for their loved ones for those unable to do so.
Stress affects how we think, feel physically and emotionally, and how we act. Often, people may feel more vulnerable. The word stress is a term that summarizes the complex experiences and emotions caregivers may go through. Some common stress reactions include fear and worry about their child's health, anxiety, being overwhelmed with their caregiving duties and managing daily demands, anger, shock, sadness, grief, helplessness, frustration, guilt, and blame.
Stressful events affect people differently, and some may not appear to be affected. However, all reactions are normal. Depending on the severity of the event, symptoms may last a few days to even a few months. The stress and burden can impact sleep, causing increased fatigue, restlessness, irritability, insomnia, sleep disturbances, or poor sleep quality. This can affect your thinking, feelings, and the way you behave, such as your concentration, attention, problem solving, and the ability to make decisions. Other symptoms may include headaches or migraines, stomach aches or cramps, nausea, diarrhea, elevated blood pressure, dissatisfaction with daily activities, withdrawal from others, and mood swings.
Severe and prolonged stress may have negative consequences on the body and pose risks. Anxiety disorders, depression, tension headaches, insomnia, PTSD, weakened immune system, hypertension, also known as high blood pressure, stroke, irritable bowel syndrome, and/or substance abuse may surface.
Coping is the ability to manage and adapt to stressful life events. Some barriers to coping may be related to the lack of time to engage in self-care, the constant worrying about a loved one, or viewing their needs as less important than their caregiving responsibilities. However, it is important to care for yourself as well.
Here are some examples of coping mechanisms and self-care interventions to potentially adopt depending on your needs and preferences. Relaxation therapy such as meditation, deep breathing exercises, mindfulness, and yoga. Physical activities such as stretching, walking, running, swimming, dancing, cycling, or going to the gym. Praying, smudging, or attending spiritual services for spiritual support. Others include reading, drawing, painting, listening to music, sleeping, journaling, and playing games.
Social support plays an important role in managing caregiver stress and coping, where individuals can focus more time and attention on their ways to reduce stress. This can be support from families, friends, or healthcare providers. Support groups may also be beneficial where families can listen to what other families are going through and how they manage their stress, developing new insights from other caregivers.
It's completely okay to admit and ask for help. Talking to trusted individuals, including professionals, can help provide emotional relief, validation, and prevent the further buildup of stress.
It's often hard to remember, but important, to incorporate self-care during those stressful moments. This can include drinking water and eating snacks for added energy and to lessen the risk of negative symptoms. Here are some programs and activities at RMHC Manitoba. Families are given a welcome bag filled with essentials when they first arrive. There are also welcome baby bags containing baby supplies when a baby is discharged. Families can receive children activity and craft kits where children can use them in the craft corner inside the dining area. These are from many wonderful sponsors and donors. Support RMHC Manitoba offers to families to minimize stress include the meal program, which includes breakfast, dinner, and the grab-and-go cooler. Movie and popcorn night in the theater room where snacks and drinks are provided. Families can also sign out the theater room on their own time. Haircuts and mini manicures, which are done by MC college students. Pet visits, where families have the opportunity to play and interact with pets from St. John Ambulance. Virtual bingo night, where families can join a game of online bingo and win prizes. Using your phone or any other electronic devices, you can join through a link wherever you are. Board games, puzzle sets, a PS4 and Xbox are available for everyone to enjoy in the teen games room. The fitness room where people can work out. There's also a small playroom inside the gym for children to play in. Massage therapy, where Robertson College students come and provide massages. The Magic Room, which is a fairyland themed room that allows children to have a magical experience where they can unlock a second door that leads to a room full of toys. Children's indoor and outdoor play space, lounge areas located throughout the building, a meditation and smudging room located on the 4th floor, and lastly, RMHC Manitoba is in touch with knowledge keepers where they can visit the site and offer their teachings, knowledge, and guidance to residents. To summarize, RMHC Manitoba offers support in many ways for rural families with a child hospitalized in Winnipeg to ease the burden of caregiving.
We hope this video has given you a better understanding of how stress can affect the way you think, feel, and behave, and additional suggestions that just might make you feel better about yourself as you navigate this journey with your child.
Dear families, we commend your strength, courage, and resilience during this time.
Thank you for staying strong for your loved one and for the love, care, and support you put out in the world. We value all your efforts and we appreciate you.
Thank you for watching our video and take care. Bye!